If you're a man in your 50s, 60s, or even 70s, and you still masturbate, first of all, let me just say this. That's more common than you might think. In fact, it's completely normal. But I want to ask you something. Have you ever wondered whether it's still good for your health? Or if, maybe, there are some risks you haven't really considered? You wouldn't be alone if you thought about that. A lot of older men have silent questions about how masturbation might be affecting their energy, their prostate, their hormones, or even their emotional well-being. And honestly, there's not enough open, honest talk about this topic, especially for men our age. I'm Dr. Laura. So, in today's video, we're going to have a respectful, science-backed conversation about 10 potential risks you should be aware of when it comes to masturbating later in life. This isn't about shame, and it's not about fear. It's about awareness and taking better care of yourself in a way that works for your age, your body, and your life. Let's get into it. Now, to be clear, masturbation isn't harmful in itself, but like any habit, when done too often, without awareness, or used as a coping mechanism, it can lead to problems you might not expect. One risk is something many people don't associate with sexual behavior at all: social isolation. Sometimes, as we get older, it's easier to avoid the complications of relationships or intimacy. But when masturbation starts replacing real connection, whether that's with a partner or even just socializing in general, it can feed into feelings of loneliness and disconnection, which we know are major health risks in older age. Another thing that might catch you off guard: skin irritation or small tears in the tissue. A lot of men use too much force or don't use lubrication, especially as they age. Skin becomes thinner, more sensitive, and repeated friction can cause tiny abrasions, swelling, and even minor infections. Using a water-based lubricant and a gentler technique can go a long way in preventing this. There's also the issue of reduced sensitivity over time. This happens when your brain and body get used to one very specific kind of stimulation, like a tight grip or the same rhythm every time. You may find it harder to climax during sex, or that it takes longer. This is often referred to as delayed ejaculation, and it's more common than most people realize. Now, here's something important: masking erectile dysfunction. If you're able to maintain an erection when you masturbate, but not when you're with a partner, that could be a red flag. It doesn't necessarily mean there's a problem with your masculinity. It could be a sign of something deeper, like cardiovascular issues, diabetes, or low testosterone. Masturbation might be covering up something you should talk to your doctor about. Another risk comes down to how you're positioning your body. If you're sitting for long periods on a hard surface or hunched over, you might actually be putting pressure on the pudendal nerve, a key nerve in the pelvic area. That can cause numbness, tingling, or even chronic pain in your pelvis or groin. It's something few men think about, but posture and comfort matter more as we age. And then there's the emotional side of things. A lot of older men, especially those living alone, can start using masturbation as a way to manage feelings, stress, sadness, boredom, or even anger. While that might provide a temporary release, over time, it can become a habitual escape, rather than a healthy coping tool. If that sounds familiar, it might help to build in other ways to deal with emotions, like exercise, meditation, or talking with someone you trust. Some men also carry a deep sense of shame or guilt around masturbation, especially if they come from strict religious or cultural backgrounds. That kind of internal conflict can really wear on your mental health over time. If this resonates with you, please know that speaking with a sex-positive therapist or counselor can offer real relief and clarity. There's also something called pelvic congestion, which happens when a man ejaculates multiple times a day over a long period. You might feel a sense of heaviness, dull pain, or pressure in the pelvic or testicular region. It's usually not dangerous, but it's uncomfortable and your body's way of saying, hey, take a break. And yes, even at our age, some of us might still be concerned about fertility. If you're trying to conceive with a partner, frequent ejaculation can temporarily lower sperm count and quality. Doctors usually recommend abstaining for 2 to 5 days before attempting conception to boost sperm health. Lastly, and this is rare, but very real, some men experience what's called post-orgasmic illness syndrome, or POIS. After ejaculation, they feel flu-like symptoms, fatigue, brain fog, muscle pain, even depression for several days. Most doctors aren't familiar with it, and it can go misdiagnosed. If this sounds familiar to you, it's worth seeing a specialist. But before we paint masturbation in a negative light, let me make something very clear. When done in moderation and with awareness, masturbation can absolutely have health benefits, even as we get older. In fact, I recently shared a full video right here on this channel, where I talked about 15 potential benefits of masturbation for older men. If you haven't seen it yet, I encourage you to check it out. It's packed with useful insights. One of the most common benefits people notice is that it can help improve sleep, reduce stress, boost your mood, and, perhaps most surprisingly, lower the risk of prostate cancer. A long-term study from Harvard University found that men who ejaculated around 21 times per month had a significantly lower risk of developing prostate cancer compared to those who ejaculated less often. But just like anything else, moderation, awareness, and intention are key. So what can you do to stay safe and smart about this part of your life? First, aim for moderation. For most older men, 1 to 3 times per week is a healthy range. More than that may not be harmful, but it's worth noticing how it's affecting your body and mood. Second, use lube. Seriously, it reduces friction, protects sensitive skin, and makes the experience more comfortable and safe. Third, vary your approach. Try changing your technique, grip, or even body position. This keeps your nervous system responsive and prevents desensitization. Fourth, stay mindful of your emotions. If you find that you're turning to masturbation every time you feel down or stressed, consider other tools in your emotional toolbox, like hobbies, movement, or connection. And finally, don't ignore signs from your body. If you're feeling discomfort, changes in your erections, or anything that seems off, talk to your doctor. Especially after 50, regular checkups with your primary care provider or a urologist are one of the best things you can do for yourself. So, what's the takeaway? Masturbation at 60 or 70 isn't wrong, and it's not shameful. It's a tool. How you use that tool, that's what really matters. Done with care and awareness, it can support your well-being, not hurt it. If you found this video helpful, please hit the like button, subscribe, and tap the bell so you don't miss more science-backed conversations about men's health. And tell me, was there anything on this list that surprised you? I'd love to hear your thoughts in the comments. Thanks for watching. Take care of yourself, and I'll see you in the next video.